Why the first hour after the stroke is crucial. The first hour after a stroke is crucial for avoiding paralysis. There is a term called golden hour in stroke management and rehabilitation. It is the term used to denote the hour immediately following the onset of stroke symptoms. Experts use the general term golden hour to indicate the first hour after a trauma or stroke has occurred. The reason it's golden is because stroke patients have a much greater chance of surviving and avoiding long-term brain damage if they arrive at the hospital and receive treatment within that first hour. Even more specifically, treatment within the golden hour is more successful if patients are administered the powerful clot-busting drug, which must be given within the first few hours after a stroke. This is possible only with the help of an experienced team of doctors who can diagnose the clot and the presence of mind of the family of the patient. For 59-year-old Brandon Croft, reaching the hospital on time during the golden hour had been a boon. Brandon had high blood pressure, which is a risk factor for stroke, and often missed having his medicines on time. He experienced sudden numbness in his right hand and also lost his grip. He found it difficult to maneuver. Nobody realized what went wrong with him while he was fit like a fiddle just a few minutes before. His family members took the decision to take him to the hospital, where he was rushed to the ICU. When he reached the hospital, he complained about extreme fatigue and weakness in the limbs. A CT scan was conducted wherein nothing was noticed. But an MRI detected a large clot in the brain. In such condition, it is essential to take an injection within the first 4 to 5 hours of developing the clot. He was rushed to the ICU and it was seen that this condition deteriorated consistently. He developed total numbness of limbs. His blood pressure shot up to 220 by 140 and there was an urgent need to stabilize the same. It took around 1.5 hours to stabilize the same. High blood pressure is a huge risk factor for stroke. This can increase your stroke risk if it is not controlled. High blood pressure is the biggest contributor to the risk of stroke in both men and women. Maintaining a blood pressure of less than 120 by 80 is essential to avoid stroke and subsequent paralysis. In case of Brandon, he was irregular in taking his blood pressure medications, which made things worse for him. Uncontrolled BP, blood pressure, in this case, was the reason for this onset of stroke. However, since he reached within the golden hour of stroke, it helped him recover with medications and was discharged within a week. This is why it is necessary to know the symptoms of stroke and act accordingly to help one survive and avoid a paralysis. If there is any family member who has risk factors for stroke, make it a point to rush to the hospital if you see any of these symptoms. FAST. F. Face droops. A. Arm weakness. S. Speech difficulty. Time call emergency health services like 911/999 or the one in your country. What is surgical thrombectomy? Surgical thrombectomy is a type of surgery to remove a blood clot from inside an artery or vein. During a surgical thrombectomy, a surgeon makes an incision into a blood vessel. The clot is removed, and the blood vessel is repaired. This restores blood flow. In some cases, a balloon or other device may be put in the blood vessel to help keep it open. A thrombectomy is one of an array of services that falls under the subspecialty of interventional neurology. They are considered a big game changer in stroke care. A specially trained neurologist threads a catheter through an artery in the patient's groin to the blocked artery in the brain. A device at the end of the catheter attaches to the clot. The neurologist removes the trapped clot and blood flow to the brain resume within minutes. Brain cells are no longer deprived. See the picture. 1. Blood flow to the brain before clot removal. 2. Blood flow to the brain after clot removal.